forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everyone, we are delighted to be here again with our educational programs, and we are here to have an interview with our respectful Professor Dr. Naghili, who is a specialist of infectious disease in Tabriz University of Medical Sciences. Hello dear Dr. Naghili, we are really happy that you accepted our invitation and you are here with us today. Please first introduce yourself to our audience, and then we will go through your educational program.
Hello everybody, I am Dr. Naghili from Infectious Disease of Tabriz University of Medical Sciences. I would like to introduce myself as a university professor that who involved in training and actively training and educating medical students and infectious disease residents.
Thank you very much. I'm really happy that you are here because you have been my own professors through my educational years. And we want to know about your department and talking about your program that you are going to educate the residents or students or anyone who will attend this program. We will listen to the name also of your program because we didn't talk about the name of the program, and then we will go to the details of the program.
Thank you for your nice description about me. In addition to educational care, I also serve as the head of the infection and tropical medicine in Tabriz University. One of the initiatives I am proud of is the clinical course named Infection Prevention and Control that my colleagues and I have been offering for the several years at the universities. We have been an advanced developed educational course for the clinicians who will be working as infection controllers within the universities. We know that in modern hospitals, in developed worlds, 5 to 10% of patients acquire one or more infections. In intensive care, the healthcare associated infection affects about 30% of patients, and the attributable mortality has reached above 44%. Yes. In developing countries, the risk of healthcare associated infection is 2 to 20 times higher than in developed countries. I believe that infection control at hospitals are very important, and proper management of safety guidelines by the healthcare personnel could be very effective for prevention of the infection and ultimately related deaths. So our course name is Infection Prevention and Control course for clinicians that will be trained for about one year as a fellowship period.
Thank you very much. Yes, as you said, everyone knows about the importance of the infection prevention and also control, as it's really, as you said, a very significant problem of the hospitalized patients. And can you talk about the objectives and goal of the course?
Sure. Overall, infection prevention and control trainees play a crucial role in safeguard of health and safety of patients and visitors in healthcare setting. Some have suggested course objective for infection prevention and control are understanding the principle of infection prevention and control in healthcare setting, identify common types of healthcare associated infection and their risk factors, describe the role of healthcare associated infection and in preventing and controlling infections, demonstrate proper hand hygiene technique and personal protective equipment. Implement a strategy for preventing the spread of infection disease in healthcare setting, analyze the importance of environment cleaning and disinfection in infection control, emphasizing evaluate the impact of antibiotic resistance on infection prevention practices, develop an infection prevention plan for a specific healthcare setting, collaborate with interdisciplinary team members to promote a culture of safety and infection control. Apply of evidence-based practices to reduce the risk of infection in healthcare setting.
Great. So there is really a wide range of the objectives, and the residents or anyone who attends, what can achieve and what are the goals in this course?
The infection prevention and control residents should be able educating healthcare workers on best practices for preventing the spread of infection in healthcare setting, ensuring that health workers understand and adhere to proper and hygiene techniques, training staff on the correct use of personal protective equipment to prevent transmission of infection, providing guidance on proper planning, cleaning and disinfection protocol to maintain a safe hygienic environment. Implementing a strategy to reduce the risk of healthcare-associated infection above patients, monitoring and evaluating infection control practices to identify areas for improvement and ensure compliance with guidelines. Promoting a culture of infection prevention and control throughout the hospital to protect both patients and themselves, I mean healthcare workers.
Yeah, thank you very much. I just want to mention something that you talked about. You said that the duration of the course will be 1 year as a fellowship program. And I want to know if it is in a course that everyone should be in person here, or some of them will be online, or no, just 1 year of in-person attendance should be.
Yes. It is 1 year of attendance should be.
They should be here for 1 year. Thank you very much. And I want to hear about the course overview. If you just want to say an overview of your course, what it is.
This course is designed to provide healthcare professionals with the knowledge and skills necessary to prevent and control infections in various healthcare settings. Participants will learn about best practices in infection prevention, strategies for reducing the risk of infection, and the ways to promote safe and healthy environment to patients, staff, and visitors. So, course overviews are introduction to infectious disease and the importance of infection prevention, understanding the chain of infection and how infection spread, principle of infection prevention and control in healthcare setting, standard precaution and transmitted-based precautions, hand hygiene practices and personal protective equipment, environment, clinic and disinfection, surveillance and outbreak investigation or management, antibiotic stewardship, and the role of vaccination in infection prevention, legal and ethical consideration in infection prevention, a strategy for promoting a culture of safety and reducing healthcare-associated infections.
Thank you very much. I'm sure that it will be a very complete and great course, and anyone who attends will really benefit this course. And let's talk about the key concepts of this course.
As you know, key concepts provide a fundamental understanding of infection prevention and control principles that are essential for healthcare professionals to protect themselves, the patients, and the community from infectious disease. So, these items must be very important. Microbiology and pathogenesis. Understanding the base of microbiology, including the type of the microorganism that cause infection, how they spread, and how they cause disease. Chain of infection, exploring the different links in the chain of infection, for example, infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host, and how breaking this chain can prevent infections. Standard precautions, learning about standard precautions, which are basic infection prevention practices that apply to all patient care, regardless of suspected or confirmed infectious status. Transmission-based precautions, understanding the different types of transmission-based precaution, for example, contact, airborne, droplet precautions used to preventive infections. Hand hygiene, emphasizing the importance of proper hand hygiene as the single most effective way to prevent spread of the infection in healthcare. Personal protective equipment, exploring the use of personal protective equipment such as gloves, gun, masks, and eye protection to protect healthcare workers and the patients from infectious disease. Environmental cleaning and disinfection, discussing the role of environmental cleaning and disinfection in preventing healthcare associated infection and maintaining the safe healthcare environment. One other key concept is antibiotic stewardship, highlighting the importance of appropriate antibiotic use to prevent development of antibiotic-resistant infection, surveillance and outbreak investigation. I mean, understanding the principle of surveillance of outbreak finding for the healthcare infection and how the investigation and control outbreaks in the healthcare setting. Education and training will be very important. Recognize that importance of ongoing education for the healthcare workers to ensure compliance with infection prevention practices and promote culture of safety. I mean, the culture of safety will be promoted.
Thank you very much. They're really important, very important issues that all will be addressed in this course. I want to know about your expert team. Of course, some of your colleagues will assist you in this program. Can you tell us about them?
Our team of experienced and highly educated professionals, including infectious disease experts, epidemiologists, and related basic science professors, is responsible for training fellowship residents at the university. This training is based on our educational curriculum, which I am currently organizing.
Thank you very much. Thank you for very detailed and thorough description of the course. If there is anything you want to add, I'll be glad to hear.
Yes, I can say the infection control is everybody's business, and I invite you and other colleagues to join us.
Thank you very much. Thank you very much for listening to us. If you have any question regarding our programs, you can contact us via the email address that you see as the subtitle, and also you can see our website shown below. Thank you very much. Thank you.